Hey, it's Dr. Nick, Clinic Director at Elevation Spine. What I'm going to demonstrate here is what's called a Class 4 laser. It's also known as a deep tissue laser, and this is really amazing technology that's emerged in the last just couple of years really for mainstream usage. The deep tissue laser literally takes a stream of infrared spectrum laser light and penetrates in whatever area we choose to facilitate tissue healing. Now it does that by turning on, if you remember like elementary school biology, it does that by turning on the mitochondria. If you remember the mitochondria, they used to say it's the powerhouse of the cell. That's the part of the cell that makes ATP, which is basically the gasoline that powers the cell. So now deep tissue laser is something that, of course, you can only get in a professional office because like any treatment, it's got indications for use and it's got contraindications, which means times that you shouldn't use it. And that's important that's important in a setting because professionals know when and when not to use it. So what I'm going to do here is I'm going to take my Light Cure laser, great American company, and I'm going to apply 1890 joules to Hannah's shoulder. Now joules, Joules, that's a measurement of light particles. So you think of this like a dosing. It's a dosage. Now, I know you're probably thinking, boy, Hannah and Dr. Nick sure look cool with their sunglasses on. Well, we look cool, but we're protecting ourselves. There's a certain frequency of light in the laser that will hurt your eyes if it gets in it. So along with looking cool, we are also going to remain safe. So, which shoulder is it? This shoulder, okay. So it's more rotator cuff?
Yeah.
Okay. So what I'm going to do is I'm going to just move this over. I'll probably move this around during the treatment because what's going to happen is I'm going to start applying this laser to Hannah, and it's going to feel cold to her at first because I've got this glass ball. But what's going to happen is this laser light is going to actually warm up the ball and warm up the area. So I'm going to tell Hannah, if it feels warm, that's okay. If you feel like you're getting a sunburn, that's not okay. So please tell me right away. So you can see if I take that off, there's the laser. And what I'm doing is this actually penetrates very deeply and is very good. I'm going to move around this stuff. What we have to be careful with is dark areas. If somebody's got a tattoo or if their skin is any darker, there's a shading scale for people's skin pigment. And the darker the skin or the darker the tattoo, for example, it will increase the heat. So we have to be mindful and careful of that. And so, how we doing, Hannah?
Good.
Doing good? No big deal, right? Just kind of feels like a ball's rubbing on you.
Yep.
But is it starting to warm up yet? Not yet, probably?
No, not yet.
Okay, it will. So that, folks, is Class 4 deep tissue laser therapy. I'm going to complete this treatment on Hannah's shoulder so that she can start those tissues healing even better than normal. What I will tell her is I will say don't ice this shoulder for the next 1 or 2 days if possible, because ice can actually blunt the effect of the laser treatment. So what I'm doing is I'm watering. It's like watering a lawn. I'm kind of going in a grid-like area, and I'm trying to equally dose all these tissues in here so that they get their mitochondria activated. So what you might notice in these videos is that I've got a mask around my neck. We wear masks when we treat. Patients wear masks as well. But obviously if I'm trying to talk for a video, you can't hear very well with the microphone. But here we go.